but I like to combine everything. So I use the oncology care one protocol, which is using conjunction to layer on this protocol with a metabolic approach, and the genetic approach, the mutation approach, the targeted therapy approach, to the diagnosis for the patients. So the and as soon as the patient has an abnormality, one, we go through the workup to confirm diagnosis and learn the cellularity of the type of cancer. I immediately start patients on this protocol. Because it could take between 4 to even 12 weeks from when we diagnose a patient with a solid tumor, meaning a tumor that's not in the blood or lymphatics or the lymph nodes, to from diagnosis to start getting the first treatment, whether this is chemotherapy, radiation therapy, targeted therapy, surgery, etc. So meanwhile, in this window, it's a great opportunity that I usually start my patients on this protocol. These are just simple pills that you take every day, just like you would if you had any other chronic condition. Minimal side effects, very well tolerated. And then we layer them on with the mainstream treatment that your oncology determines according to each patient individual diagnosis. Just to name the major drugs that are out there that I use in the protocol, and I use up to I think right now I'm using about 20 up to 22 different type of drugs in this protocol that are not cancer drugs. They're just regular drugs that you use, from antibiotics to ivermectin, mebendazole, atorvastatin, metformin, even tadalafil, right? So there is a lot out there, and these drugs work synergistically. Each one enhances the activity and potentiates the other in managing and preventing cancer cells from continuing to proliferate. So the metabolic approach, very short, is changing the environment in which the cancer cells are being fed to continue to develop. So we cut out all the nourishment to the cancer cells, so to speak, eliminating things like sugars and of course lifestyle interventions. As I said, I have worked across East Coast, coast to coast, and I believe in doing the best that we can and use the best of both worlds. We use the scientific approach and also the integrative approach to treating and preventing cancer progression. If you are a lover